We live in a quantify yourself era, and many patients are also collecting health data. And the widespread use of internet and smartphones has opened the door to self-monitoring and more hybrid care models. The COVID-19 pandemic has further accelerated remote monitoring. Also for the patients with interstitial lung diseases. And interstitial lung diseases are a heterogeneous group of over 200 rare diseases with a disease course that varies from reversible to progressive and even deadly, especially in the patients with progressive pulmonary fibrosis. And these patients have increased symptoms, decreased mobility, often have to use oxygen and die prematurely because of their disease. And patients with ILDs often encounter problems with accessing care and a delay in diagnosis. Home monitoring in ILD holds great potential for improving care throughout the disease course. It could improve access to specialist care, reduce the burden on healthcare systems, guide treatment decisions, identify acute and chronic disease worsening, and improve and support quality of life for patients with interstitial lung diseases. And besides the advantages for care, it can also facilitate and simplify trials and registries. The most commonly used outcome measures to monitor patients with ILDs are, of course, their symptoms, their well-being, their medication tolerance, but also lung function labs and sometimes imaging. And many of these outcome measures can also be assessed at home. And home spirometry has been used in ILD for several years now, but studies with other devices such as pulse oximetry, activity trackers and cough monitors are emerging. At the same time, challenges have surfaced, including difficulties in accessing home monitoring door, for instance, reimbursements, cost, or access to Wi-Fi. And there are also technical and analytical problems that have been identified, and furthermore, implementation issues on large scale have arisen. So I think in practice it is necessary to find the right balance between home monitoring and hospital monitoring, and that should be based on patients' needs, wants, and possibilities. Though there are still many research priorities for home monitoring, I think most of these hurdles can be overcome. And what we envision is a complementary role of home monitoring and hospital monitoring, where these outcomes are combined and can be used to profile patients and a group of patients to predict their disease progression, response to therapy, and detect changes. And this integration of home monitoring would allow for personalized management plans, and this would be guided by a continuous feedback loop. And the implementation of home monitoring in ILDs, I think, has the potential to empower patients and allow them a greater involvement in their disease management. And this will foster meaningful collaboration between healthcare providers and patients, both for care and research in ILDs.